Welcome to Sciatica Live on Wednesday. Today we're going to talk about a patient who was 63-year-old female who suffered with sciatica. But again, we do these videos for a couple of reasons. Our goal is to sort of give you hope. A lot of people suffer with sciatica not knowing that there is a way out. So we want to give you some hope, but also some encouragement as you go down this path to resolve your sciatica issues. Again, sciatica is one of those conditions where if you don't get it treated properly, it can either last forever and or sometimes make it worse by getting a surgical procedure that doesn't work out the way you expect. So what we do is we help you make better decisions by giving you patient-reported data. Patient-reported data is information about what the results of the treatment are that are reported by the patient. And it's not satisfaction. It's not, I was satisfied with their procedures or I would recommend their procedures. It's, this is the level of improvement that I achieved. That's the most important thing here. We want you to be happy, but we also want to know who gets the best results. So it's about patient-reported outcome data. We're the only ones doing this. Our goal is to help you make better decisions because doctors do not have to report data. So that's why we're doing this. It's about hope, it's about encouragement, and it's about getting the data to you so you can make better decisions. Today's patient that we're going to talk about, a 63-year-old female, back pain and sciatica, pain down the leg, had suffered for 4 years. Okay, she'd been dealing with this for 4 years and it wasn't getting better. Before she saw us, she went to 4 different doctors. She had an MRI, she went through a course of physical therapy, she went through chiropractic care, and she was taking anti-inflammatories. Again, there's kind of a pathway that people go down. They start with sometimes physical therapy or sometimes they start with medicine and then they progress. So if physical therapy didn't work, try the chiropractor. Chiropractor didn't work, taking the anti-inflammatories. Okay, wasn't getting better, and she'd had this for 4 years, and she was at a point where she wasn't thinking she was going to get any better, so she was kind of losing her hope. So she came in to see us. Again, we have a 9-step process. Our process is, number one, have you better understand what sciatica is. Sciatica is a pinching of the nerve. You need to know what's pinching the nerve. Okay, if your goal is to unpinch the nerve, you need to know what's pinching the nerve. The key to any successful treatment is match the treatment with the problem. So what we do is we have an educational process that helps you better understand what's causing your pinching your nerve. But we also have 10 movements. Now yesterday was Tuesday, we did a video last night about breathing. There are 10, and actually it's 12 things. We increased it to 12 because we identified 2 other things that we kind of had to educate you about. So it's really important that you understand what makes you better, what makes you worse. We have tips. It's on every Tuesday. We have Tuesday's tips. Yesterday was about breathing. Last week was about sitting in a chair. And then after we identify what is wrong, we perform a very specific type of MRI, and then we formulate a treatment plan around what the problems are. There are 5 different conditions that will cause sciatica. Sciatica is a pinching of the nerve. I'm not going to go through all this. There's a video on the anatomy of the spine. But just know that there are 5 causes. She had a herniated disc, a degenerated disc, a bulging disc, all that were compromising the nerve. Pinching the nerve, when you have sciatica, very often is a result of something pinching the nerve as it exits through the spinal canal. Okay, there are 5 different conditions that will cause that. We have a video on that. We'll put that in the link above in the description below. So she had 3 of the 5 causes. Okay, these are probably the most common causes. The herniated disc, the degenerated, and the bulging disc, all will start to compromise that space where the nerve comes out. So she had those different conditions. Here's the herniated disc pinching into the spinal canal. Here's the degenerated disc getting thinner, and there's the bulging disc. So she had those 5 things. Our goal of our treatment is to take pressure off the disc. The reason our treatment works so much better than everybody else's is because we have the ability to open up that space and take pressure off the disc and allow for healing of the discs. We have a scientific study that was recently published in a medical journal that is archived in the National Institute of Health database. We're going to put that link on there as well. We perform advanced physical therapy. We take pressure off and get healing in the disc. It's called unweighting, so we have you wear a harness and we're not pulling you apart. We just take a little bit of pressure off and then we have you do the exercises. And what that does, we have found, it frees up that space where that nerve is being pinched. It restores the integrity of the spine. So, patient came into our clinic. On a scale of 0 to 10, her back pain and sciatica pain was a 7. Again, she'd been suffering for 4 years. The key is how long she had been suffering. Because you get to a point where you start to lose it a little bit because the pain doesn't seem to want to go away. And your thoughts are that maybe the pain might not ever go away and maybe I'll never live a normal life. She came in, her pain was a 7, 10 is the most severe. Her Oswestry Disability Index, which is a 10-question questionnaire, was a 60, which is high. Okay? There are 5 categories. We scored the Oswestry Disability Index, and the Oswestry Disability Index is the patient-reported outcome. This is the part where the patient reports how much better they are. This is important because it's not I would recommend it, it's how much better I am. What's the outcome? I like the staff. What's the outcome? The outcome is either you got better or you didn't, and it's a number. We can track your number. So we know there are 5 categories. She was a 60, so she was borderline on crippled. Okay, at one more point, she would have been crippled. It's called crippling disability. It's the effect that the disability or the pain has on the quality of your life. How much can you do? How much can you not do? The higher that number, the less you're able to do. So she was in this category. Now, a couple things we know. If you're above a 40, and in some cases if you're below a 40, but typically if you're above a 40 and you have a pinched nerve from a herniated disc, you are a candidate for surgery. Now in her particular case, because she had a bulging disc, a herniated disc, and a degenerated disc, she probably needed either a laminectomy and or a fusion to solve her problem. Okay, so she had some pretty severe problems. She was a candidate for surgery, obviously not getting better with the other treatments. Came in to see us, we gave her 40 treatments. What we know is the higher your score, the higher your Oswestry score, and the longer you've had the pain, the longer it takes. It doesn't get better overnight. It's not a quick fix. She tried the other fixes. She tried the physical therapy. She tried the chiropractic. She did not get any better. She came in to see us, went through the program, went through our 9 steps. There are 9 steps. There's not 4, there's not 6, there's 9. And by the end of that 9, as you go through the program, we've identified what the problem is and we treat you appropriately because you have to match the diagnosis with the treatment. Went through the problem. At the end of her therapy, her back pain was a 0. Her Oswestry was a 0. 100% better. What's the outcome? The outcome is she had gone from a 60 down to a 0, and her pain had gone from a 7 down to a 0. How you measure how successful a procedure is for your condition is based on these metrics, these numbers. These are low back pain metrics. Okay? Oswestry Disability Index is absolutely the gold standard. Harvard put out standards of what outcome measurements you need to use to identify how well the patient is improving. Oswestry Disability Index is that measurement. So we know the outcome on this patient went from a 7 down to a 0. Obviously she felt better. 60 down to a 0, completely functionally back to normal. Able to live her life. I get questions all the time. I'm a runner. I want to run. I've got a sciatica and a herniated disc. Can I run? We've had marathon runners come in, get our treatment, and run, go back and run more marathons. So the point is, our goal is to get you functionally fit and stable so you can live a normal life. That is our goal. Why do we do this? We do this so you understand better what outcomes are. We do this so you better understand that there are other options for you. We want to give you hope and encouragement. The New Year's coming, so if you have sciatica, you need to get this in shape so we can get you back on your feet. This is what it looks like. Okay, briefly, this is not the video explanation about herniated discs, but we have one, do herniated discs get better? Okay, so watch that video. The key is to free up the space where the nerve comes out. If you've enjoyed what we've talked about today, you can like our Facebook page and you'll be notified when we go live, but also every Tuesday you'll get a tip. There's 12. And we'll add more to that because the big one now is texting. Text next. So if you like us, you'll see us when we go live. Same thing on YouTube. We have all these videos on YouTube. They're archived on YouTube, so you can go to YouTube and take a look at those. So subscribe to our page. But more importantly, if you have somebody that you know that is suffering from sciatica and they need some hope, share this link with them. Share our information with them. Because if you share it, they can get better. That's our goal. We're going to save all our patients from sciatica. Thank you very much. Have a good day. And we're going to do another one later. We're going to talk a little bit more about outcomes, and we're going to show a little bit some of the tips that we did 2 weeks ago that we told you we're going to refresh it. So that's coming later in the day. We'll see you then. Thank you. I'm out. Have a good day. Drive safe. Be careful.